All right, I have Dr. Guzzi here, and I am going to do an interview on stroke with Dr. Guzzi. Dr. Guzzi, during an emergency, what would be some of the calming techniques to help and get important information to help your patients? The family is super upset and you're having a hard time understanding them, and you need to get information to calm them down.
The important thing is to ask them, is there any previous history? Did anything like this happen before? Do they have any other significant disease process that may have led to the event, the stroke? Heart disease? Do they take any medication? Any recent falls? Engage the family in the understanding of what is actually going on. Then the second part of that is actually make sure the patient is safe. Do we have a safety situation for the patient? Are they in a place that's protected? Are they potentially on the floor, not half falling off something, not potentially at risk of fall or something like that? Are they comfortable? Can you communicate with them? Are they communicating with you right now? I think it's really important to engage the family in that and make sure the family's engaged with you in that same process, because once families feel like they're part of the solution, it's much easier for them to be engaged and remove themselves from the panic they feel.
Okay. What is your time frame to help save someone who is having an active stroke?
Well, if it's a thrombotic event or an embolic event, whichever one you think, and there's a potential we could fix it, we like to have at least a 2 to 4 hour window. So getting them here as soon as possible, getting them diagnosed as soon as possible, probably getting an aspirin in them or some sort of antiplatelet therapy in them as soon as possible in case it is a clot, and then diagnosing them by doing an MRA or some study on their brain to see if there's an occlusion. And then in the modern world we live in, we get them to an IR doctor, an interventional radiology doctor, who can potentially go in there and either dissolve the clot with TPA, or if it's possibly an embolic phenomenon, can go actually grab the clot, pull it out, and restore perfusion. So time is money, brain is money, time is brain. The faster we can get them here, the faster we can diagnose them, the faster we can get them to an IR, the better we do. After about 4 to 6 hours, there tends to be some ischemic changes. So after about that time period, we may not have as good a recovery as we want.
Okay. What are some early signs and symptoms to help non-medical staff to be more aware of a possible stroke onset?
It's interesting because strokes mimic everything. So a stroke can be just gazing off into space, inattention. We've had patients that suddenly have a bit of a slurred speech and everybody says, oh, they just woke up sleepy. Numbness and tingling, usually distally, proximally, usually one-sided, because most strokes tend to be one-sided, not two-sided. You have to think about any symptomology that is out of the ordinary. So whether you're a nursing staff, home staff, paramedics, EMS staff, if you arrive there and they really can't figure out why the patient has slurred speech or why the patient's confused, which is one of the biggest problems with a stroke, you need to take a step back and say, could this potentially be a stroke going on? And that's actually what I have.
Okay. What are the survival rates of patients who call 911 with a stroke?
Don't know the actual rate, but it's very high. Very rarely you die from a stroke. You die from the complications of a stroke long term, i.e. being in a bed sores, long-term complications. But it's very rare that you actually die from the actual acute stroke event itself. So the survival is probably close to 100%. Now morbidity, i.e. how you survive and how you get better, is probably about 70-30. About 70% return to normal over time, 30% have a significant deficit. Rarely do you die though.
Okay. So the 30% that have the deficits and stuff that do pass, is it because they maybe didn't catch it in time?
If they didn't catch it in time, it was too large, other comorbid illnesses, hypertension, diabetes, renal failure, other things that come with them. So it's not just their stroke, it's the other comorbid illnesses they have that add with the stroke.
Okay. How often do you see stroke patients come in?
Pretty often, usually once a day at least. Sometimes we have little runs of 3 or 4 a day. We do a lot of rule-out stroke, patients who have symptoms that are consistent with a stroke. I think just like with chest pain, we've done a great job of educating the population that if you have these symptoms, you need to seek help. Because as we just talked about, the faster you get here, the faster you diagnose you, the faster we get you treated, the better off you do. So I think that we are seeing more than ever before. We do a lot of patients that we actually rule out for stroke.
Okay. Someone called in to 911 with what appeared to be a stroke symptom. What could the 911 dispatcher do to help until EMS arrived?
I would tell the family to stay calm, make sure the patient's calm. You don't want them getting an increased blood pressure. You don't want them having any of those other symptomology. So tell them to stay calm. If there's an aspirin in the house, potentially get an aspirin in their mouth as soon as possible. That's an antiplatelet therapy. So if it is a clot and there's platelets there, well, potentially you can help with that as well. Reality is that if they're gather anything you can, stay with the patient, but gather medications, any recent medications they've taken. It's important to know all that stuff, especially for us when they're coming in. Did they recently take an antihypertensive pill? Are they on a beta blocker? That's why their heart rate's 40. So gather all that, or tell them to gather as much information as they can for us so that we know what's going on with the patient.
Okay. Biggest
point is when was the last time they were normal?
Okay, so timing of when the last normality.
Last time you saw them normal.
Okay. And what can you do to help a stroke patient that is within the guidelines?
We get them diagnosed. We find out where the lesion's at or the obstruction's at. We let interventional radiology know or neurointerventional radiology know. If it's potentially a thrombus, we can potentially go and retrieve it and get it out. If it's a clot, we can go and do directed TPA into it and then hopefully have that clot dissolve. So if we can get them within that 4-hour window, we can hopefully get them to a higher level of care where they can have the emboli or the thrombus removed or unobstructed and restore flow to that damaged portion of the brain. And the brain's pretty cool. It's incredibly plastic. So if you can get flow back, they tend to do pretty well pretty quickly.
Is there any information you can provide to anybody that is non-medical to help with stroke?
I think the American Stroke Association, American Heart Association have a tremendous amount of literature in there for looking at stroke, how to manage stroke, also what are the signs and symptoms of a stroke. But I always remind people, anything abnormal, especially if you're elderly, hypertension, atrial fibrillation, diabetes, kidney disease, any of those diseases which come along with it, you're always at a risk of a stroke, and you need to be very acutely aware that it can happen to anybody at any time.
And what would you say the average age range would be to start looking for stroke symptoms?
Greater than the age of 60 to anything past that point. Just happens to be when our body wears out, about age 60.
Okay, so it's not common to see a stroke in...
Very uncommon, unless you have other disease processes, lupus, some other very rare diseases, but very rare under the age of 60, very rare.
Okay. Is there any information you'd like to share? That?
Be aware, think about it. Most important thing for EMS and for people is to gather the information. So last time normal, what is their baseline function? Are they taking routine meds? Do they have other big health problems? It'd be very important to know if somebody was having a stroke who had atrial fibrillation. It'd be very important to know if somebody has a stroke and has significant coronary artery disease. Those are two really important things for us to actually know.
Okay. Well, thank you so much, Dr. Guzzi.
You're welcome, Sally. That was easy.